Hi, Ron Ehrlich here, and this is our monthly newsletter. And I just thought I would update you on the month that was. It's been a big month. We've got back on board. Things are getting back to normal. I hope you're noticing that. I think within another month or two, people will say, "What pandemic?" Because there are other news items that are filling the news, or I shouldn't say news services. I've got to stop using that word. They're media outlets. The media outlets are now focusing on other things. Well, one thing I should acknowledge is that this month of February, while on the one hand we may be returning to normal as far as the pandemic is concerned, the floods, the rains that have occurred on the east coast of Australia and specifically in southern Queensland and northern New South Wales, as well as parts of Sydney, are just phenomenal. I mean, it's hard to imagine that we had a drought 2 or 3 years ago where our dam levels, which supply Sydney, were at something like 30%. Now, the dams in Sydney are meant to provide Sydney with enough water for 5 years, I think. Well, it used to be 7 when the population was smaller, but I think it's now 4 or 5 years. And the dam levels were at 30%. Well, after the drought broke, incredibly, the dam levels went up to 70 or 80% almost within a week. And now they are overflowing. I mean, our dams are full. I have some patients that came from country New South Wales where the dam levels were at 3%, and they're now at 110%. So we live in a country of extremes. There's no question about that. But the devastation that has occurred in homes up and down the coast, particularly in those areas, is quite staggering. And my heart and my best wishes go out to those people, and we're going to see how we can help. We're certainly going to focus on this in the coming month, how to deal with some of these issues from a health perspective and from a rebuilding perspective. What's involved there is mind-blowing. To empty your entire contents of your house out and leave them in the middle of the street because they are now useless, and the whole thing is terrible. But the support that the public has given each other is a reminder of what has made us great as a species, Homo sapiens, humankind. We've done a program on Rutger Bregman's book Humankind, and it is our ability to communicate, to co-regulate, to cooperate, to collaborate that has made us the species that we are. And while you hear all about what is going on wrong in the world, and we hear a lot of that in the media, the one thing we are reminded of is that when things are down, humans step in to help each other, and that is a profound message. But we kicked off the month very timely, actually, with Admiral Chris Barry, who used to be the Chief of the Defence Force in Australia, but we talked specifically about PTSD and how ubiquitous and widespread it is, and Chris made the statement that that it affects every Australian in one form or another. And it's not just returned servicemen that suffer from PTSD, it's people that are abused, either domestically, as children, sexually abused, physically abused, bullied, are in an accident, or all sorts of things can be traumatic. And when you have a traumatic incident that isn't resolved, the potential for you to suffer from post-traumatic stress disorder is very high. So when you take that broader brush that Chris used and know that even if you hadn't suffered from it, people who you know, either close to you or who you work with or friends, may have, then it's not hard to see how every Australian in some way or another is affected by it. And so that was interesting. But what was particularly interesting, and what an opportunity for me to have a conversation, me, humble healthcare practitioner, humble dentist, know nothing about defence, and ask Chris Barry what he thought of, for example, the Iraq conflict, because he was Chief of Defence Force right up until 2002, and of course we were part of the coalition of the willing that invaded Iraq. And he made the point, and it's particularly poignant for what's going on in Ukraine at the moment, is that the key to going into any conflict, there are 3 keys to going into any conflict. The first one is you need to have a good reason to go in. And by good reason, he means a morally good reason that has the support of the country which you are invading. So a good reason is number one. Number two, you need to be a force to be reckoned with. And number three, you need to win and get and have an exit strategy as well. So they were really important points, and what an opportunity for me to share with him my insight into the Iraq War, which was where is the precedent historically in the Middle East for a conflict to be resolved simply and quickly militarily, number one. Number two, what is the exit strategy? And number three, if we are going after a dictator like Saddam Hussein, where do we stop? I mean, there are quite a few around the world. So that was my observation back in 2003 with my limited experience, in fact, zero experience in defence and politics. And basically, I think Chris agreed with that assessment, which was an amazing experience. But Chris's our Fearless Outreach Group is a not-for-profit organisation. That was fabulous. Then we spoke to Todd Penbarthy, and it reminded me of another nutrient that there was a few nutrients that he discussed, but B group vitamins, and in particular B3 niacin, was one that he also focused on. And later in the month, we spoke to holistic pharmacist and herbalist Gerald Quigley, who is an old friend and who I've known for many years, and he was talking about ubiquinol. And we've spoken on the podcast about vitamin C, vitamin D. Actually, we're going to do a program about vitamin D specifically. We've spoken about a whole range of things, magnesium, zinc, selenium. And the point I'm trying to make with this is that biochemistry, the way the body works, is very complex. And you might need to be on some supplements, but the key is to be on a nutrient-dense diet from foods grown in healthy soil. So that is a focus, and don't ever get overwhelmed about, oh no, not another nutrient. My God, I thought I'd nailed it. No, there are 50 or 60 different nutrients that the body needs. And so, that's all about what a nutrient-dense diet is. It's about why biochemistry is so important. It's why prescription pads are so popular, because in a 5 or 10 minute consultation, you haven't got time to explore people's problems. You just want to hear their symptom and how you're going to manage it. Not cure it, manage it. And in Gerald's episode, we also talked about mitochondria, which are the power batteries of every cell in our body, or of the cells in our body, and they literally are all about producing energy to make us and keep us healthy. So this is these were some really great conversations I had, and in one of the Healthy Bites, I raised the issue about relative risk versus absolute risk. Now, that's something that many of you in the non-medical world may not have even heard about. But let me explain it to you like this. If you are trying to sell a pharmaceutical product, you will talk about relative risk. For example, a vaccine has a 95% efficacy. That's a relative risk assessment. But an absolute assessment of the risk reduction might mean that you, as a 40-year-old or as a 10-year-old or as a 5-year-old or as a 50-year-old who is healthy or not, remembering half the population have comorbidities, so it's very nuanced. Your absolute risk reduction in taking the vaccine might be anywhere from 2 to 4% down to 0.005%, which is a lot less impressive, a lot more nuanced, a lot more accurate, a lot more honest, but that is the absolute risk. But I'll guarantee the vast majority of you may not have heard of that distinction. Not even, and I'm not talking about drug representatives going into doctors' surgeries selling medications. They use relative risk all the time. It's how statins have become so ubiquitous. A rep will walk into a doctor's surgery and say, if you prescribe a statin, you can reduce your patient's chance of getting heart disease by 36%. My God, who wouldn't do that? A doctor would be irresponsible if they didn't reduce the risk of a patient by 36%. That's the relative risk. That's the drug rep trying to sell the doctor the product, and does it very successfully because statins are one of the many blockbuster drugs out there. But the absolute risk would say, listen, doc, your patients have a chance of getting heart disease 3 in 100. That's their absolute risk, and we can reduce that absolute risk to 2 in 100. Do you want to take this medication? I know there are polyneuropathies, which means they affect the nerves at your extremes, or myopathies, which means they affect muscle. I know they affect memory. It can adversely affect memory, and we need to check liver, but it's going to reduce the risk from 3 in 100 to 2 in 100. Do you want to do it? And the doctor would go, I might think about that. But if the rep walks into the doctor's surgery and says, hey, if you take this drug, it'll reduce the risk of heart disease by 36%. What do you think? Yes, I'll do it. Both of those are the same, because to move from 3 in 100 to 2 in 100 is a 1/3 or 36% reduction, 33.33, whatever. But you see what I mean. Similarly, in this pandemic, you have never heard about the absolute risk. And this is why I made the statement in last month's newsletter about so many people, from the highest of high government officials to the highest of high healthcare professionals and the so-called experts, telling you that the efficacy of a vaccine is 95% or so. They're talking about relative risk, which, as I said, is what you would use if you were trying to sell a product, but not if you were trying to make an informed decision. So we talked about that, and I thought it was worth mentioning. Look, I introduced you to the Holistic Health Institute, and yes, we are putting together this wonderful 21-day program challenge with a whole lot of other extras in there. Look, it takes a bit of time, we're busy people. I've got to practice, I've got a lot of things going on, and I've finally got a great team surrounding me to help me do some of these things that I've been wanting to do for so long and share with you. But I basically thought it would be also worth sharing with you our mission statement for what is going on. I've sent out a few invitations to some wonderful people coming up in the next month or so to come onto the podcast. And in describing it, I say my audience is a well-informed audience who's focused on holistic health from an individual, community and planetary perspective. Not always all at once, but everything's connected, so we're all affected. That is our overall mission. And if I had to look at how we approach, or how I approach health and how we will approach health in our programs, I actually see health as a metaphor for health is a balancing beam. And on the one hand, it is to identify and reduce the stresses in life that have the potential to compromise our immune system and promote chronic inflammation, the common denominator in all diseases. So identify and reduce those stressors. And on the other hand, to build resilience by focusing on the pillars of health. And that whole balancing beam pivots on your genes and how your genes express themselves, called epigenetics. So you are not a victim to your genes. You can choose to some degree how your genes express themselves. So when we look at the stress, anything that compromises your immune system and promotes chronic inflammation, we focus on 5 areas of stress: emotional, environmental, postural, nutritional, and dental stress. And dental stress I include, and I believe as a dentist I'm the best place to include that. I include it for 2 reasons. 1, for that reason, but 2, I include it for anybody with a mouth who is interested in their health and has never fully connected the two. The mouth is the gateway to the digestive tract. It's the gateway to the respiratory tract. Literally, the shape and size of your mouth determines the shape and size of your upper airways, your nasal passages, and your ability to breathe well and sleep well. It is also the site of the 2 most common infections known to man, woman, or child: gum disease and tooth decay. We implant more materials than any other profession put together, and we'd hope they weren't toxic. And mercury is a common material used in dentistry, to name but one. And also, because this area is so sensitive, if you clench or grind your teeth, It causes muscles throughout the body, and particularly in the head and neck, to contract. And chronic musculoskeletal pain, headache, neck ache, jaw ache, backache are a huge problem. So that's why I include dental stress. It's not just about are you in pain or not. On the other side of the balancing beam, we focus on 5 pillars: sleep, breathe, nourish, move, and think. And each of those has important crossovers and implications. And actually, each of the stressors and each of the pillars affect each other. So that's a holistic perspective. It's not some new age philosophy. It just happens to be the way the body works. And while we're at it, just happens to be the way the planet works. Another theme that I'm really passionate about is lessons from the past. And in the coming month, I'm going to be talking to, Tyson Yunkaporta, who's written a wonderful book called Sand Talk: How Indigenous Knowledge Can Save the World. And I do believe that we have a great deal to learn from lessons from the past, and we have a great chat there. And there are so many other things. So I hope the month of February found you well. I hope I'm looking forward to the month of March. If you're following me on Instagram, you will know that the month of March is actually my animal-based month. Yes. A few months ago, about 4 months ago, I slipped and fell down at the rocks at the local beach when I was with my granddaughter, and I landed on my right hip and my shoulder, and so it's been getting sore, and so I've had lots of treatment now. I kind of thought, I'll just take it easy, do stretches, but I really needed some professional help, so I then sought out my massage therapist, a physiotherapist, I also an acupuncturist. I do my stretches, and also I use low energy laser, but I also thought I would reduce my inflammation, because inflammatory chemicals stimulate pain receptors and put you in a more hyper-vigilant state of pain. I've been doing pain for a long time, pain management for a long time in my practice, so I thought I'd practice something that I'm very familiar with. So I'm on an animal-based diet. And that is because vegetables have some problems. Phytate, oxalates, salicylates, FODMAPs, lectin, gluten. There are a lot of things within vegetables that are there to protect vegetables against predators like animals, insects, and us. And they can be pro-inflammatory. So March, I'm off a lot of that. I'm taking some fruit, some avocado, some bananas, some pineapple, but mainly animal-based, and I'm not getting this from just any animal. I'm getting it from animals that are grown on a regenerative farm. And regenerative farms, animals have a happy and healthy life. They have one bad day in their lives, but what they also do is they regenerate the soil. It takes nature 500 years to generate 1 inch, 2.5 centimetres of soil. On a well-managed regenerative farm, that can take 3 to 5 years. So I'll repeat that. Nature, 500 years to grow 2.5 centimetres, 25 millimetres, 1 inch of soil. On a well-managed regenerative farm, in 3 to 5 years, you can regenerate that same amount of soil. So they are the answer, and we're going to have some interesting guests to further explore that. Hope this finds you well. I'll keep you posted. Look out for the program. It is coming, I promise, certainly before in the next few months. This is part of being a dentist. You become obsessive and compulsive about putting something out there that's really exceptional, and that's what we're wanting to do. Hope this finds you well. Until next time, until next month, this is Dr. Ron Ehrlich. Be well.